Dr. Greg Gamache here. What I want to do today was just really take a couple minutes and discuss whiplash and dizziness. Anytime somebody's involved in a whiplash accident, some symptoms you might experience would be some neck pain, some stiffness in the neck, headaches, potentially some ringing in the ears, some confusion, or potentially even dizziness. And when you look at dizziness, dizziness and balance really go hand in hand. There's really three systems in the body that control balance. What's called our vestibular system, which is our inner ear, our cerebellum, which is located in the back of our head, our dorsal column, which is really the back part of our spinal canal. And if we look at all three of those, the one that I'm going to really focus on is the vestibular system, that inner ear. And before I do that, let me just really talk about some quote unquote, some common things that potentially could cause someone to be lightheaded or dizzy. And I think we probably all experienced it ourselves, maybe going from a sit to stand too fast, and we get that momentary feeling of being lightheaded or dizzy, or like feeling like we're going to pass out. And really what that's caused from is what we call orthostatic hypotension, or basically just a momentary drop in our blood pressure. It can be actually caused to actually be more frequent if we're having cold-like symptoms, flu-like symptoms, maybe if we have some allergy issues, potentially if we're really anxious or have a high level of stress. Those factors can actually cause us to have more symptoms or orthostatic hypotension. But the other factors that we could actually be contributing to that would be whether or not we're on maybe some tobacco or alcohol, or even certain types of medications can actually make that more frequent. Some things that you want to consider to follow with your doctor with is if you're having some bleeding issues, if you're having, whether it be colitis or if you're having some ulcers. Those can basically actually cause more orthostatic hypotension, or more severe causes of orthostatic hypotension. But back to the vestibular. Basically, when we look at the vestibular system, basically it's called benign positional paroxysmal vertigo that people experience when they get that feeling of just being dizzy when it's associated with the inner ear. And if we look at the inner ear, basically inside of it we have these semicircular canals, and in those canals are basically a bunch of fluid, and that fluid basically is traveling through there and it's making contact with these hair-like projections. Okay, these hair-like projections actually are basically connected to some sensory nerves that communicate with the brain. And what all that does, it gives us basically a spatial awareness. We get this 3D awareness of where we are in space. Okay, and then what can actually happen that causes that dizziness is sometimes those canals can get blocked or occluded. Okay, when that happens, no longer is that sensory nerve effectively communicating with the brain and telling us where we are. So then we get that feeling of being really dizzy all of a sudden. Okay, that can actually be taken care of fairly naturally. If you Google whether it be Epley's procedure or got another one written down, Brandt-Daroff exercises, you can actually actually clear that up pretty easily and naturally. Okay, some things to consider that are a little more serious when you're looking at dizziness is heart and stroke issues. Basically, if one would be passing out or having a lot of chest pain, or maybe some weakness in their arm, or basically arm pain or jaw pain, or nausea, or they're having some maybe racing heart or just irregular heartbeat, you definitely want to be concerned. Okay, the other thing you want to be concerned about is if you're having a stroke with dizziness. Okay, and there's some associated symptoms with that be if you're having some paresthesia or some weakness, especially if it's just one side of your body, and then all of a sudden maybe you're drooling, you're slurring your speech. Those are all serious warning signs that you're potentially having a stroke. Now, in those last two cases, 911 is what you want to do right away. Definitely get medical attention immediately. But if you have any questions, concerns, comments, please message me below. Would love to answer any questions you might have. Have an awesome day.